Hi, I'm Dr. Lennox, and I want to talk about babies and children. You know, very few people really think about chiropractic care for babies and for young children because, chiropractic care as it's presented oftentimes, involves adjusting the neck and things that seem so intimidating to babies. But I want you to know that there's more to care for children and babies than manipulation in the way that you've seen it. We have little adjusting devices that are very gentle, and I guess the only really way to tell you about it is it's a little bit like magic. There's a way of muscle testing babies by testing moms. It's called surrogate muscle testing. I think my favorite discussion is people say, well, is that scientific? I always laugh, say, no, it's not scientific. It's pretty much like magic. The magic of it is that we're not quite sure how it works, except that I know how to work it. I've been working it that way for 37 years. When I was in my second year of chiropractic college, my third child was born. So treating babies, dealing with babies, pediatric issues was just part of my life from the very beginning. So I'm very used to treating people who are pregnant. I'm very used to treating newborns, very used to treating young babies. Now, if you've had newborns, they don't express themselves very clearly, except everything's wonderful and everything's horrible. It's just one way or the other. And so it's very difficult sometimes to figure out what's going on. One of the easiest things for me to help you with is a colicky baby. That's when the baby usually is upset. He or she eats and throws up or cries, or a baby tells you that life is so horrible, there's nothing worse going on in the universe than what's happening to me right now, and then it burps and it's all bliss all over again. So one of the things we do is we deal with colicky babies, and what I want you to know is that it's easy. It's really easy to work with. Most of the time, it's a combination of a little stress in the gallbladder and the diaphragm locked up, and it's a very simple, gentle, easy manipulation, so much so I can teach you how to do it at home, so you can take better care of your baby. I can give you rubbing points that you can rub on the baby that help stimulate digestion, holding points that help stimulate digestion, that you can do a lot better care. Now, a lot of times we have children that come in, and a lot of times we have children that have runny noses and things like that, that the runny nose leads to the cold, and the cold leads to antibiotics, and la, 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 la. And most of you who are watching this have been overexposed to that idea. But some of the things you never get to think about is, I found out that apple juice is the #1 cause of runny noses in children. I didn't believe it at first, but I just kept testing it, seeing. And it's one of those simple things you can do. You try eliminating apple juice from your child's diet, because everybody gets a juice box, right? So we have ways we can test to see if your children are sensitive to certain kinds of foods, because if a child is eating foods they're sensitive to, they'll have allergies, they'll be irritated, they'll have runny noses, they'll be cranky. And these are simple things for me, but concepts that are different for most parents. Now, other kinds of things that can happen is that sometimes babies are traumatized in ways that they can't express. It was not very long ago that I had a young mother call me, and her baby was traumatized, and she didn't know what the trauma was. All that she knew was that her baby, when she moved her shoulder, was in a tremendous amount of pain, and the doctors told her it was nothing. Now, it's not nothing, but somehow we were able to do the kind of care that helped that baby feel better and direct that mother to get the right kind of pediatric care, so that someone was at least looking at that baby from, yes, there's a problem, instead of it's just nothing, it'll get better. Children love chiropractic care. Children love nutritional stuff. They respond very, very well. The closer to childbirth that you treat someone, the faster they seem to get better, because everything's in that new regenerative phase. So care for babies is something I do a lot of. I can teach you how to take better care of your babies. I can teach you how to deal better with your children. Children respond very, very fast to dietary changes. Most of the time, they're just so available to feel better. And it's just, I hate to say it's easy. It's just easy for me because I love it so much. Another thing we need to pay a lot of attention to with children is they're poisoned a lot. We live in environments where people use pesticides, people use very, very harsh cleansers. Schools, oddly enough, clean with very toxic chemicals. Your neighbor decides he wants or she wants to spray for ants or for bugs on the bushes. All of those things affect us really a lot. And one of the things that we can do with our diagnostic skills in my office is determine whether the baby or the child is reacting to environmental issues or food issues, or whether there's structural issues. And once you can differentiate those things, then you can set about a course of treatment that you can be in charge of for your child, that I can help you with, so that it's not this great mystery where you're constantly using antibiotics and antihistamines and things like that. I'm not philosophically opposed to the use of medication. There's a time and a place for it, and we're so grateful to have it. I just think it's overused because children are underdiagnosed with things that we can fix in the world of natural medicine. Thank you.